Reassuring doesn't always mean providing solutions. Sometimes it's providing support. And I think there are some kind of key tips that I think can be helpful for supporting patients when they're ready, when they're asking, like, what about my kids? It's important to talk to them about the need to know, right? So like, what are the things when you leave this hospital that your kids are going to see, hear, or notice? That's a great place to start.
You're listening to the Oncology Nursing Podcast, where ONS Voices talk cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Jamie Weimer, Manager of Oncology Nursing Practice at ONS. Today, we're talking with Kelsey Mora, Certified Child Life Specialist, Licensed Clinical Professional Counselor, and Chief Clinical Officer at Pickles Group in Chicago, Illinois, about how oncology nurses can support young families during a parent's cancer journey. As a reminder, you can earn free NCPD contact hours after listening to this episode and completing the evaluation we've linked in the episode notes. Welcome, and thanks so much for joining us today, Kelsey.
Thank you so much for having me.
So let's start things off just with you telling us a little bit about yourself, your background, and working with kids who are coping with illness or grief or just everyday life.
So as a dual certified child life specialist and licensed clinical professional counselor, I really bring together the health experience and therapy side of things. And so I worked in pediatrics for almost a decade. And really my role was being right at the bedside, helping kids cope with all kinds of illness and grief related challenges, either as a patient themselves, as a sibling, or as a child of an adult patient. And I went back to grad school to get my counseling degree because I was also working in private practice and just finding that at times there was overlap where kids might be navigating a chronic illness, an acute illness, a parent's illness, a death and dying situation, and need more support. And so now I bring those two backgrounds together, both in the private practice setting and then at Pickles Group, where we support kids who have a parent with cancer.
Well, that's just so wonderful to hear. And knowing that resources and professionals like you are out there to help oncology nurses as we navigate some of these challenges in our own practice is just wonderful to know about. I think maybe it's never been rare, but it always felt a little bit less common in having young kids with parents who are getting cancer. But unfortunately, what we're seeing is trends and cancer diagnoses are happening earlier and with younger patients themselves. I think we are more often now finding that our patients who are maybe young adult also have young kids at home. And so this topic, I think, is becoming increasingly important for oncology nurses who maybe predominantly worked with adult patients, not necessarily pediatric patients. Like you said, we're seeing some crossover. And so I think there's a great need for all oncology nurses to understand this dynamic and to learn from you today on how we can maybe be part of the solution to help both our patients and the children that they might have to navigate the journey together.
Definitely. Yeah. What the research is showing, unfortunately, is that these earlier diagnoses of younger ages are on the rise. And so there's children who need support, definitely.
So clearly when a parent has cancer, the whole family is affected and they go through that diagnosis together. How do you see children of different ages responding to cancer and its effect on their lives?
This is a common question that we get. And I think there's a concern that young kids won't understand or won't remember. And what we actually see is that even the youngest kids can really pick up on changes in their environment. So when there's a cancer diagnosis, there is inevitably unavoidable change and disruption, whether it be to caregiving routines and availability, schedule, their appearance and inability status, hospitalizations, and certainly observed emotions. And kids are curious at all ages. So they pick up on things and they try to make sense of things on their own. And so my role is really around helping nurses help parents and parents help their kids understand what's going on so that they're not left kind of trying to figure it out on their own, because they will notice and pick up on changes that are just inevitable when navigating a cancer diagnosis.
So what are some of those evidence-based strategies for parents who are facing cancer themselves and they need to support their children during this time? Can you talk about maybe some of those strategies?
There is an article from 2017, Benet Shah, that has kind of been our North Star at the Pickles Group organization with 3 primary ways to support kids, which is something that, has always been true in my field. And so providing kids with honest and age appropriate information. So it's about providing them with a narrative to make sense of what's going on. And so it is honest, but it is age appropriate. So you kind of tailor it to, the age or the development of the child. The second strategy is coping and communication skills. So modeling and teaching them how to feel, how to handle those feelings and how to communicate with one another about this difficult topic. I think as parents, we want to protect our kids, and it's not realistic to feel happy all the time. As nurses, you're seeing really hard things and it's natural to not feel happy during those things. And so modeling and normalizing that for kids is so important. And the last is connecting to peers. Pickles Group was born out of founding families where kids were saying, I want to meet other kids who can relate to this, because the second there's a cancer diagnosis, they feel really different from their friends and their peers. And so being able to connect with others who can understand more of their lived experience is super important. So honest age appropriate information, coping and communication skills, and then connection to peers are the three primary strategies that are built on supporting kids facing cancer.
That's wonderful. Now, for oncology nurses who are maybe initially focused on the parent who is maybe their patient, how can you recommend that oncology nurses prepare and support those parents for having what could be difficult conversations with their children or teenagers about cancer and potential loss?
I always like to clarify, because I think when I worked in pediatrics, and then people say, well, this isn't pediatrics, we're working with the adult patients. But what would happen is we would constantly get paged to the adult side for nurses or clinicians who were like, I have this parent, right, who's the patient and is asking, like, what about my kids? And we have something called the Pickles Way, where we use it with children, but it's really applicable to adults as well. And so it's 3 steps. The first is to listen, right? So as a nurse, really listening to what your patient is asking about, what are they concerned about? And then being able to validate that, help them feel like whatever they're concerned about is the most important thing. And it's hard because as a nurse, you have so many medical things that you're managing. And yet if that patient is looking at you and saying, what about my kids? Like, that's what they need in that moment. And so trying to balance all the many things that nurses are responsible for. And the last is like reassuring them. So really listening first, validating those thoughts, feelings, fears, concerns, and then reassuring them. And reassuring doesn't always mean providing solutions. Sometimes it's providing support. Like, this is really hard. It's such an important question. And I think there are some kind of key tips that I think can be helpful for supporting patients when they're ready, when they're asking, like, what about my kids? It's important to talk to them about the need to know, right? So like, what are the things when you leave this hospital that your kids are going to see, hear, or notice? That's a great place to start with those really need to know things, and then move forward into those want to know, right? What are the kids asking about? Because when kids are asking hard questions, usually they're ready for more information. So that can be really important to kind of initiate conversations, is to start with what they need to know and then also what they want to know.
I think those are some great defined tips, because I can see myself in this situation as an oncology nurse working with a patient. And because I have my own children, my children are school age, but I think it would be easy to jump to what I would do based on just my own experiences and my relationship with my children. And that may not always be the right approach. I like that we have, as you mentioned, some sort of evidence base to pull from to say, here's a standardized approach to kind of focus what is a very big, very ominous, very challenging topic into manageable kind of bite-sized pieces versus feeling like you have to have all the answers, right? Because I think that's what makes the diagnosis scary for everyone, adults or children alike, is that there's a big piece of it that we don't know. There's always something that we may not have the exact answer to. I think that's especially challenging for everyone. But as you've recommended, there are certain defined pieces of that question or of that experience that focusing in on small little questions, addressing topics as they come, sounds like a good approach.
Yeah. And for adults, it's scary to not understand what's happening. And it's also scary for kids to not understand what's happening. And so giving them some information, even when we don't have all of the information, is so important. And I always tell parents that I don't know is a real answer. That's an honest answer, right? Being able to say, that's a great question. I don't know the answer right now, but as soon as I do, I'll definitely talk about it with you, and then follow up and talk about it with them. And so I think as a nurse, navigating the uncertainty, if you're at the early stage of a diagnosis or a change in treatment, or maybe during an acute hospitalization, being able to validate for parents that it's okay to not have all the answers right now. What your kids are looking for is as much as you can give them and support over solutions.
I think that's so important. I think sometimes just saying, I don't know, but we'll learn about it together, or let's try to ask a different question and find out the answer. If it is something that's just a matter of gap in knowledge that can be solved together, and if it's something that, only time will provide more information, then giving that clear communication and reassurance that when I know more, as much as I can tell you, I will share with you in that age appropriate way. I think those are some great messages to provide patients with, so that when they talk with their children, they feel like they do have something to say to provide that reassurance.
Yeah, I have so many kids who will tell me like, I met my parents' nurse and they were so nice and they explained everything to me. And so, obviously coming out of COVID, some things look different, but when, and when we're not just talking about young kids, we're talking about teens too. Like, I think we overlook that some of the things that teenagers don't understand. And so like having a nurse that can explain to child visitors, like, oh, this is an IV bag and this is medicine that we're giving your parent, can be really impactful when there's the time and the opportunity. And it really means a lot to kids when they have that experience or that choice to visit their parent or be involved in their treatment.
I think that brings up a great point. And I think every institution approaches it differently when we're dealing with the adult population in terms of our patients, in terms of allowance for allowing children of a certain age to come back, whether it's for their visit with their doctor, whether it's during their treatment. And certainly there are reasonable restrictions and thoughts about why we would want to protect children from that environment. Mainly the medications, the drugs that we're using can have risk. And so we want to make sure we are limiting exposure. And so there are certainly necessary boundaries and containments for that. But I think the conversation we're having today is worthy of challenging those notions of if your institution does have a blanket age restriction on if kids are allowed and what is that age. I think it's always worth asking that question. Well, why do we have this policy? And are we limiting our ability to make that connection with the patient and their whole family, including their kids or maybe even their grandkids, if they have a very close relationship with their grandchildren or they're taking care of their grandchildren as their children? I think it's important for us to always pause and ask that question of, are we creating a less comprehensive experience for our patient by not involving or allowing their children or their grandchildren at certain parts of the journey of the process to be part of that visit? Because I think you've given that great example of when kids are able to meet with the nurse who their parent is close with and building that relationship with. Can we help both our patient and their children by being able to establish that bond and that relationship as well? In my own personal practice, I've had to pause and ask those questions about why do we have this restriction? Maybe there's great reason. And if we do, perfect. If we don't, how can we reflect on and maybe make certain accommodations that are more welcoming and inclusive of the entire family?
Yeah, it's so much about thinking outside of the box and, of course, balancing safety with comfort. I always tell kids that there's some things that are in place to keep the patient as safe as possible, and your comfort and coping is really important too. So how can we prioritize both of those things? And with technology, FaceTiming is also an option, or having, maybe having kids write letters or do pictures for their parents' room. Like there's definitely other ways to include a child. I have little ones picking out like a small stuffed animal to put in their parents' bag, or, fitting within the restrictions that exist that are safe and help those children and parents cope and connect. But yeah, I love the idea of just thinking outside the box, asking questions and caring about these things that are so important to the parents and the children.
Absolutely. And sometimes just the experience of if my parent is going in to get an infusion for their chemotherapy or whatever their treatment is, if you don't know what that experience looks like, you can fill in the gaps with maybe things that aren't accurate or make things seem scarier than they are. And so sometimes even just that ability to see the environment and just kind of be exposed to what the experience is for their parent, I'm sure can provide the right developmental age of a child, can provide maybe some reassurance of just, this is what my mom or dad is going through right now. So I love that. Just don't be afraid to ask the question of why we do it this way. Lots of times, great reasons, sometimes opportunity to reconsider if this is still the best path forward.
Yeah. And I mean, when I worked in the hospital, a lot of times nurses were calling the child life specialist to help facilitate those visits, which is great when that's a service that's available or accessible. But I think little strategies, tips, and tools that nurses and other clinicians can use themselves can make that difference if those services aren't available, or it's a kind of an imminent, a kid shows up to visit, if that's not a restriction and you're trying to work through that scenario. And so really going back to those, I mean, we have 3 tips that we really prioritize. And the first is honesty really is the best policy. And that's about sharing information. So sharing information with the kids. The second one is when in doubt, keep things normal. And when I say that, I always talk about like, there's nothing normal about having to navigate this as a parent. But what I mean by that is like sharing expectations, helping kids know what's going to be the same, what's going to be different. And what about the unexpected, or in the case of visiting a parent or a clinic, what's it going to look like? What's it going to sound like? What am I going to experience? And that last one is about sharing feelings, normalizing that expressing feelings is healthy, and that as a parent, you can model that for your kids. So a lot of times I hear I have to be strong for my kids, and being strong doesn't mean not crying or having real emotions. In fact, that can be a really powerful way to model healthy feelings for children. And that is strong. It is strong to have real feelings about a hard thing. So I think those 3 tips can be really helpful for nurses to keep in mind when they're navigating these in the moment situations where patients are asking about their kids.
So let's talk a little bit about grief. Unfortunately, we know that grief is a part of the diagnosis, whether it's grief of eventually end of life, or if it's just grief of things that are lost in the short term. Like, as you mentioned, some things will remain the same, some things will change. But we know that grief is, of course, intertwined with all diagnoses across the journey of that cancer experience. So what role does grief play for both kids and parents as they respond and cope as a family?
Well, first and foremost, it's definitely not a one size fits all, right? Like everyone copes different, but I think it's so important to normalize that grief occurs the second that there is a diagnosis, right? Because there is so much change and transition and loss and uncertainty. But a lot of times for kids, that's just like the loss of the way things were before, or the loss of being able to relate to peers, or the loss of the things that my parent was able to do before, or just them not being around as much. Those are experiences of grief. And actually what I love about grief is that it's not one feeling. It's a whole bunch of mixed up feelings. And so being able to just acknowledge and validate that like it's normal to have all these mixed up feelings, happy, sad, grateful, relief, confused, worried. And that is grief, right? That is a response to a hard change or loss. And then, of course, like having these conversations with kids, it's not a one-time conversation. It's not a one and done. So starting those conversations earlier can help to have something to go back to when there is a significant change. So if we're talking about anticipatory grief in terms of end of life care, it can feel a lot more approachable to build on conversations that have already started with the diagnosis than feeling like you have to cover so much intense content in one conversation with kids. And so that's why I really encourage nurses to encourage parents to have these conversations sooner, just with the information that they have, because then you'll have a lot of subsequent conversations along the way, including when prognoses are changing and the focus of care is changing.
Are there any things that parents should watch for in terms of behaviors or demonstrations from the children that are showing they are having maybe a disproportionate reaction or prolonged concerns to the diagnosis of their parent?
That's exactly the key, the disproportionate reactions, right? So when there are behaviors that seem really out of proportion with the situation, so maybe dysregulated emotions more often than not, difficulty sleeping, nightmares, changed eating habits or patterns, heightened fears such as separation anxiety, or the fear of leaving a parent, or toileting regression of any sort. Some of those behaviors that are really out of proportion with the situation, because often I believe that experiencing cancer and grief in the family is really situational. It's not always pathological with respect to mental health. So all of the approaches I've discussed are really about prevention and thriving and resiliency. And there may be times when a child is having a more difficult time coping and needs more intensive support. And so it's important to acknowledge and watch for those things, but also to recognize that some of the tips and tools we're talking about can actually help prevent long-term implications for children too.
So what are some of the ways that you see nurses and parents, or nurses helping parents, can help to prevent some of those long-term implications in children?
Honestly, talking to kids about what's going on, I think having those honest, age-appropriate information conversations are so important. And it doesn't look the same for every family. I always say, parents are the experts in their children, and we, whether it's me or the nurses, can be the experts in oncology or psychosocial emotional support. So we blend those two things together. You know your children best, and here's what we found to be most helpful or important for kids who are facing these situations. The situation is occurring whether we talk about it or not. And so kids feel more relieved to understand what's going on than to try to make sense of it on their own, because like I said, they will notice or pick up on things. And so we can prevent feelings of worry, anxiety, distress by guiding and reassuring kids with their feelings and what's going on. It's just so important to their understanding and processing. And truly, when we talk about these things with kids, I find that you end up talking about it almost less, right? Because it's like the kids start to trust that my parents are going to tell me when there's a change, good, bad, or otherwise. So the in-between can look kind of normal, right? I can go to school, I can do my activities. If we're not talking about it, I'm constantly worrying about it. And so that is just so important to help kids cope. It's also helpful for parents to be able to just parent their child in a normal way and not feel like they're having to hide or prevent something when it's more out in the open. They can be their most authentic self as well.
Absolutely. That was just my thought that I had, that the burden of maybe trying to keep it secret. Again, the intentions are good and wanting to protect the child from additional stress or worry, but it's counterintuitive. It almost makes it worse for everyone within reason by not just being open and sharing that information. There was a statement you said, it's happening whether we talk about it or not. When I heard you say that, I also reflected again on my experiences in the adult population and those patients who are adults that have children or grandchildren at home that are close and very integrated into their everyday life. The challenges that our adult patients are facing are happening whether we ask them about them or not. And so, I would challenge any of our listeners who do deal primarily with adult patients to always consider, like, how can I bring up the concern that they might be having with talking with their children at home? Because I can't say that I think back on my own practice and have strong memories of those instances where I did specifically sit down and ask my patients, how are your kids dealing with this? Or how are you able to talk with your grandchildren about this? And so, I would challenge nurses to think about, even if their patients are primarily adults, being intentional about asking those questions of, have you talked with your children about this? What struggles are you having? What are you worried about? Because I think in all the other things that we are trying to do as oncology nurses, tending to all of our patients' needs, that one might not always rise to the surface. And so I think it's important for us to consider how we can bring that one into the discussion in a more intentional way, at the right time or over time at the right frequency. Because even though that might not be our primary lens in terms of the patient themselves and their side effects and just keeping them on their treatment and well cared for, that is certainly a primary concern for the patient when they go home. So I love that statement. Whether we ask it or not, it's something that our patients are dealing with. And so as nurses, I think we need to find a way to make sure that it is part of our routine assessment as well.
I love that. Yeah, we want to change the system of like an adult oncology patient having the opportunity to have someone ask or anticipate young people in their life that may be experiencing this secondarily. I think that's so important because they're going home and then they don't have the resources or the words to even begin. And at that point, it almost feels, then it feels more crisis mode, right? Like, oh no, my kid is asking me these hard questions, or like, I don't feel well and they want to go play catch outside and I don't have the energy and I don't even know where to begin. And so when they're in the hospital or in the clinic and their children aren't there and they're with a trusted healthcare provider and they're starting to think about all the many things that are on their mind, that is often one of the top things that's on their mind, even if it's maybe not one of the top things that healthcare providers are asking about.
So speaking of that, what are some of the resources that you would recommend that oncology nurses can use, either for themselves or to provide to their patients who are parents of younger children?
I know that every healthcare system looks really different. So I think it's always important to just kind of identify what resources already exist within one's healthcare system and lean on those kind of built-in teams. And outside of that, Pickles Group has a free support kit that is downloadable. It can be requested on our website and it can be handed to a parent that is asking, what about my kids? It has a lot of the tips I've shared today in terms of honesty, sharing expectations, sharing feelings. It's a handout that can just be handed right to a parent. On our website, we also have a list of a lot of different organizations and books, both for cancer discussions, end of life, hospice, for different age groups. And so we really want to fill this gap. And so when parents are asking that question, being able to have that support kit to hand to them, and then hopefully they can get more involved and access some of the other resources. And there's so many organizations operating in this space. And so we may have a few books on our website, and then one of the organizations that we list may have more books on their website. And so they can get as far and deep as they want to, but we are hyper focused on the children of adult patients. And so it's a really, great place to start in terms of just having those ready to go resources.
I love that. And as you mentioned, looking internally at your own organization and also connecting with our colleagues in pediatrics for pediatric oncology. Certainly the discussions might be slightly different, but are there tips and tricks and resources that, you might be able to borrow from your own pediatric departments that are part of your organization? And so creating those relationships, building that time in to get to understand how they work with their children who are the patients, that perhaps can just inspire nurses who are primarily with adult patients that have children, just how that they can integrate some of that discussion and that content with their patients as they journey with them through education and understanding of what their diagnosis means and kind of how they'll go through their treatment. I think those are some relationships and connections that can be built internally, in addition to all the great resources that you've mentioned. And of course, we will be sure to link many of those in our episode notes today so that our listeners can see them readily and hopefully decide how they can integrate them into their own practice.
Yeah. I think it's definitely a great suggestion for listeners to identify if they have a child life department within their hospital, or some hospitals do have a child life specialist designated to the adult side, but it's not as common. But that doesn't mean that child life specialist wouldn't respond to a call to come provide support or resources. But as we know, resources can be spread thin throughout the healthcare environment. And so we want to be able to fill that gap when it's needed most. And then, of course, building those relationships if and when they can be available and respond. So I would highly encourage checking to see if there's a child life team that can respond to those situations as well.
Well, Kelsey, thank you so much for all the great information you've shared today. As I said earlier, I think this is a really important conversation, knowing the trends of age of diagnosis and that this will become, unfortunately, maybe more common for many nurses who don't practice in the pediatric population. And so I really appreciate the time that you've spent with us today and some of the resources that we'll be able to provide to our listeners as well. As we wrap up our episode today, I do like to ask a few just quick fire questions to help summarize. So to start that off, what's something about this topic that's not often discussed, but you wish people knew more about?
I think just the misconceptions that kids are too young to understand, or they won't remember, or that talking about it will scare them too much. When in fact, kids tend to be more scared by what's not talked about and what they don't understand, because they try to figure it out and make sense of it on their own. So when we think we're protecting kids, they will then turn around and protect us and not talk about it. And so we as adults have to demonstrate that it's okay to talk about so that they can feel like they can ask their questions. So it is an opportunity to model these things when you're facing a difficult situation like an oncology diagnosis with young children.
Yes, I love that. How can healthcare professionals and nurses evaluate their own implicit bias when working with young families during the parent's cancer journey?
This brings me back to that point around listening first, listening and seeking understanding first. Parents are the experts in their children, and it's not a one size fits all. Of course, there are some best practices, but it's so important to understand how that fits into a family's values, beliefs, and traditions, and then really meet them where they're at and follow their lead. So that can look a lot of different ways. And we have to understand the why behind why a parent may have different views on how to approach this with their kids before we start providing suggestions. And so it's just about listening and understanding first. So then a healthcare professional kind of knows where to follow their lead.
What additional training or education would you recommend to oncology nurses so that they can stay prepared for these types of conversations?
We are actually launching a clinician-specific webinar monthly starting this fall. And we also hope to continue to work credentialing so that nurses and other healthcare providers can receive their continuing ed for participating in some of these educational opportunities. So that will be coming soon. But like I said, requesting the support kits on our website to share with patients, I think could be really helpful, and getting to know the field of supporting kids of parents to feel more prepared. As I mentioned, that article by Benet Shah from 2017 is a quick read, but it really highlights those evidence-based practices around how to support kids facing parental cancer.
And then finally, what are some additional resources for patients or parents that want to learn more and be prepared for this?
As I referenced on our website, we have what we call our Learn page. And so it's where we link other resources, both other organizations that are related to this field, books. So that's a great place to review some resources and then kind of connect to more through that.
Wonderful. Well, Kelsey, thank you again for your time and just sharing all the great information you have. Do you have any final comments to share with our listeners today?
Thank you so much for taking the time to prioritize this important side of oncology nursing, of thinking about the young people in their lives who might need support.
Well, thank you so much.
Thank you.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.